Hi, this is Deshauna Yamini, and today we are at Ingenious Health and Wellness to interview the beautiful and brilliant Alendre McGhee, and she is a DNP, APRN, CNP, FNPC. We're going to learn what all that means in just a moment. Show Me What You Do, episode 2 starts right now. Today we are here with the wonderful Alendre McGhee, who is the owner of Ingenious Health and Wellness. Thank you so much for having us today.
Thank you.
And you and I met right around the end of 2000. I met you 23 years ago when we were working for the same employer.
A long time ago.
Long time ago.
Long time ago.
So how soon after that did you start the medical field or enter the medical field, and what was your inspiration?
I had always had a love for the medical field.
Wow.
I had medical and legal were my biggest passions, and when I was younger, and my parents had always told me to go computers and learn computers because they said that computers were going to be the generation, right?
Yes.
And I did, and so then when I got tired of the business world, I went back for my passion, which was medical. And look where, computers are
Yes.
in medical, right?
Yes.
And then I decided to do medical, and then I just found a path. And I wasn't sure where I wanted to go with it, and found nursing, and then found a nurse practitioner, and that's where I'm at.
Okay.
So yeah, but this has been my passion for years, even when I was a younger child.
So you said you found your path. So we want to talk about your educational path. What was that like, and how did you get through that?
It was challenging, because I had a family. I had to start from ground zero because I had no healthcare background. I had all business and legal background. So I went back to school. I worked as a medical transcriptionist. I did phlebotomy, and then I took the whole nursing path. I became a nurse's aide. I became a LPN, RN. Got my bachelor's, my master's. My master's, and then got my doctorate. And went and did all that full time while being, a full-time mom, a full-time wife, and working a full-time job. And it was stressful.
So you were working a full-time job while you were going to school?
Absolutely.
Oh my gosh. Okay, so how old were your children at that time?
They were young. My kids were in school. They were actively in school. I had 4 children. They were 2 were just entering high school when I started to do my nursing career. I think my oldest one had just graduated from high school by the time I finished my RN degree. She had graduated from high school, was going to college, and then I was just starting my RN track when my second was about to graduate from high school. So they were high school, and I had my other 2 were in middle school. My kids were active. They were in band. They were in dance team. They were soccer. They were football. I mean, it was hectic. I was working night shift and going to school in the daytime, sleeping in my car, transitioning between going to school, getting off of work, going to school in the morning, and still trying to be active with what was required at home. So they were up in age.
Wow.
Yeah, it was very hard.
Yeah. So what was your support system like?
Support, my husband was very supportive, as much as he could, because he worked in a factory at that time. So it was, I had a lot of family support between my sisters, my mom, and my positive mentality. My whole thing was short-term sacrifices. I kept telling myself, short-term sacrifices. I got to make this short-term sacrifice to get where I wanted to be, so that ultimately my family will be able to enjoy the riches that we wanted to have. Because I knew that once I obtained my goals, we would not have to have some of the struggles that we were enduring.
So what schools did you attend?
Okay. So I got my LPN. I actually went to Miami Valley CTC and did my LPN program through them. And then I was accepted into the fast track program at Kettering and got my fast track for Kettering for my RN. And then I got into Ohio University and did my bachelor's. And then I was accepted into UC and did my master's. And at the time that I wanted to go to UC, I actually had wanted to go to Ohio State for my master's, which was for my family nurse practitioner. but they required you to have the GRE. And I had a high GPA because I had already had a bachelor's degree. This was a second career for me, but I was like, I'm not taking the GRE. I'm not doing that. I had almost close to a 4.0. And so I got into UC, and as soon as I got into UC, Ohio State dropped the GRE requirement.
Wow.
So I'm like, fine, whatever. I'll go ahead and finish out at UC. So I got in UC, finished out my F&P, and got my master's, and then I was done. I was not going back to school. I was teaching at Clark State in their nursing program, and then I got an invite to come up to Ohio State for their doctorate program. And I'm like, I'm not going. I'm done. I had no desire to get my doctorate degree, but I have always wanted to teach at the university level, and I knew you had to have a doctorate degree to do that. And then Ohio State had just dropped their doctorate program requirements, and I'm like, okay, I'll just apply for it. 'Cause I wanted to teach there, and I had actually got into their was going to get hired on to teach there in their undergrad program. I was like, okay, fine. And I got accepted into a doctorate program. And I got my doctorate from Ohio State, and then went back and got my postmaster's for mental health. So now I'm certified for family nurse practitioner and psych mental health nurse practitioner. So I have my doctorate and my postmaster's from Ohio State.
That is fantastic. I know you and we became friends on social media, and I kept seeing you hit all these milestones, and I was super excited for you. This is absolutely wonderful.
Thank you.
My next question is there are lots of initials after your name. Please explain to us what they mean. And you've already talked about some of your certifications.
Yes.
But what does all of that mean? And start in order.
In order, okay. All right. So when is actually there's a whole bunch more. You have to drop them as you get your higher education. Right. So my DNP is a doctorate of nursing practice. A lot of people are so confused when it comes to the doctor's degree, right? Because they see, especially when it comes to a nurse practitioner, because they're like, they don't understand what is a nurse practitioner. Because a nurse practitioner we can assess, we can diagnose, we can treat, we can manage patients, same as a physician. And so when they see that, they're like, oh, so you're a doctorate. Well, some of us hold a doctorate degree, but a doctorate of nursing practice. So we can hold the title of a doctor, which I do as a doctor of nursing practice, the same as a doctor of podiatry, doctor of chiropractor, same as a doctor of medicine or doctor of osteopathic. So that doctorate is a title or degree that we earn. So I have a doctorate of nursing practice degree, so I can technically use the title doctorate of nursing practice. So that's what my DNP is. And then I have FNPC, which means I'm a certified family nurse practitioner. And then I also have PMHNP, which is a certified psychiatric mental health nurse practitioner, which means I can treat patients for mental health across the lifespan as well. And that's one of the only ones I have up there.
That is awesome. So you can treat the whole person.
The whole person, mentally and physically.
And that's what we need.
Yes.
So please share with us the goal of Ingenious Health and Wellness and what services you offer to patients, because you offer more than what a normal physician's office would.
Absolutely. Absolutely. When I decided to open my practice after COVID became an issue, my goal was I wanted to be a one-stop service for patients, because so many times patients get lost in the shuffle when they have to go see this provider, see that provider. They're pushing this direction. I wanted to be able to treat the patient holistically, because a lot of times if they're not mentally well, they're not going to be physically well, and vice versa. So I felt when I went back and got my mental health certification that if I can, a lot of times we miss that part of that component. When patients are coming in and they're having a lot of body complaints, they're always complaining of abdominal pain. We need to tap into what's going on mentally. Are you having a lot of unexplained stress, anxiety? Because that's tapping into your gut health, right?
Yes.
So I like to be able to treat the whole person, and that's where our goal is, to be able to treat you holistically, taking care of the whole person, and that's why we do both primary care and mental health services.
Okay. So during our tour, you showed us the different rooms where you provide certain services. Talk about those services.
So we do have our Ingenious Health and Wellness side is just strictly more the primary care side of it. And in that aspect, I can treat patients on the primary care as well as my other new practitioner who can do just primary care only. And then we have the mental health room where I do the mental health. And right now I can do the mental health, but I do have telehealth providers also who can do telehealth mental health services. But then we also have our dose bar, which is our med spa services. And unfortunately, for some of our holistic services, insurance don't cover for those because insurance doesn't really do a lot to promote overall wellness. Right. So we do offer a lot of holistic services like vitamin shots, IV therapy, weight loss, health coaching that is part of our dose bar services. So that's one of the areas that we offer in our room, as well as we also have an esthetician who does some of the more holistic services because facials, massages, stuff like that also helps you to be able to relax. But again, those are services that are more of a self-pay service.
Okay. That's fantastic. I was looking at your pictures in the back. I mistook someone for a family member, but that is your daughter.
Yes.
So Ingenious Health and Wellness is now a family affair.
It is.
So talk about how your children have been inspired by you.
It's so funny because everyone says, "Oh, your children follow your footsteps." Actually, my children actually went to healthcare before I did. They were taking healthcare at CTC before I even transitioned into the healthcare. And then I actually decided to tap into nursing. I just ended up finishing before they did because they were still in high school. But yeah, I have 4 children, and all 3 of my daughters are nurses. My one daughter who's working here with me now, she is actually a nurse practitioner. She's certified nurse practitioner. My other daughter, who has also joined the practice, is a nurse, but she's also now is an esthetician. So she offers the esthetician service. And I have another daughter who's a nurse that whenever she relocates back to Ohio, she also comes up and work with me as well. And then I also have a son. He's not a nurse, but he also does wellness with me as well because he is also a trainer.
Yes, I love it. How has your moving into the medical field, how has it changed your life how has it enhanced your life as far as doing what you want to do, going where you want to go? I've seen some wonderful travel pictures. Talk about that aspect of it.
It has enhanced my life because it helped me to be more focused on my well-being, taking a step back, being more present, taking time for myself because we all get wrapped up in just going. And being in medical allowed me to lead by example, to make myself a priority as well. Taking the time to go on vacation. So, as all my patients know, at least once a year I shut my business down and I say I'm gone for 2 weeks, to take care of my own mental health. So it does allow me to have more flexibility in my schedule. Being in my own practice also allows me more flexibility to see my patients. I see patients on my own terms, meaning my patients know they get adequate time to spend with me and they're not just in and out the door. I listen to them. I have a flexible schedule. We offer evenings, we offer weekend hours. So being in my practice has allowed me a lot more flexibility.
That's excellent. So as a medical professional, what is the number one piece of advice you share with your patients the most?
They have to invest in themselves. They have to take the time and make the time to take care of themselves. And they have to not rely on medication to do it. And I talk to all my patients. My patients all know that I'm very transparent with them. And I give them that hardcore advice, that, if they don't take the time to do it now, voluntarily, they're going to be at a point where they may have to do it involuntarily.
Yeah.
No.
And you want to do it while you still have some control.
Absolutely.
That's fantastic. Is there anything else you want to share with us about your practice?
We're passionate. We're just passionate about taking care of our patients. So come and see us.
And you know what? I am going to come and see you.
Come see us.
Thank you so much for sharing your story with us today. I feel like you are one of the most inspirational people I have ever met.
Thank you.
I mean that sincerely.
Thank you.
If you want to learn more about Ingenious Health and Wellness, what is your website?
www.ingenioushealthsolutions.com.
Fantastic. And we'll see you next time.
Thanks. Thank you.
Thank you.